The third lecture is the importance of supportive therapy. This talk is entitled The Role of Supportive Therapy. For this diagram, I begin again with the ski slope figure to show that the progression of this alcohol addiction takes place with inevitable consequences and troubles. If you have not already listened to and viewed the first of this series called The Symptoms and Phases, I would strongly urge you to do that for a clearer understanding of what I am representing by my little signpost along the slope. For a long period of time, the percentage of one drinker out of 10 drinkers ending up addicted to alcohol has been the accepted fact. I have gotten comfortable with the evidence that points in the direction of a possible physical cause, even though such a physical cause has not yet been identified. The predisposition has been triggered by the person's regular and heavy use of this drug. The moralist among us is correct in saying that if the person so involved had not drunk so much or even at all, he or she would not have had a serious problem. The legally outlawing drinking for our nation did not work out well at all. The use of beverage alcohol is widely used and enjoyed probably by the majority in our society. I have often felt, however, that it may be unfortunately true that we do tolerate excessive drinking too freely. Among my Swedish relatives, there were aunts and uncles who went to the bars on Friday or Saturday, and they would get intoxicated. I've always said they were drunks, but not alcoholics. Yet, a cousin among this group reportedly died at an early age because of the physical complication of alcoholism. You just never know. It is reported that among the Jewish population there is a low rate of alcoholism, and that among them there is no tolerance of abuse of this drug. No tolerance of one Jew becoming intoxicated in the presence of others. Safe drinking seems to require always a moderate use of this drug. But I digress. The very early symptoms of increased tolerance with its companions of sneaking drinks and taking them rapidly will not allow a moderate use. The memory loss of the blackouts is a strange and baffling experience, but included among the experiences leading to LOC, loss of control. Again, I must define this in the two types: the bender spree drinker, the one who has lost control of the amount consumed once he now feels safe in taking the first little drink, and the other, the daily drinker, who may never drink to excess, but is under the influence of the drink around the clock, and just simply can't abstain. I keep reminding us that this second type of alcoholic may be spared most of the social disorganization of the first, but eventually the physical deterioration will be present and there will be severe withdrawal problems. Separating this person from the daily use of alcohol may, and the admission to a hospital, the person may unexpectedly go into delirium tremors. The type 1 bender spree is the most common of the problem drinkers in our society. Getting drunk, he has to blame others. He often goes on the water wagon and then, with some change of pattern, goes back to drinking. The problems in the family, with the friends, on the job, with the courts, financially and health-wise, all get bigger and bigger. The snowball down the slope increases in size until finally one of the 5 items I name may push the individual to be serious about stopping the drinking. It could be another drunk driving arrest, or maybe an accident happens and he is at fault, or on the job he has already thought would be his forever is gone, or the spouse, after many false threats, has finally packed up and is gone. Or it may be he is sick and tired of feeling sick and tired. The decision to stop drinking has been made by the individual. The next immediate problem he faces is how to get 72 hours free of any drinking. If he is still able to do this, as we say, cold turkey, well and good. If not, then some form of medical support through detoxification would be required. The essence of this talk is that recovery from addiction is not done in isolation, but in community and with many different supports. I use a dial with a pointer to illustrate what I have in mind. On the left side of the dial it reads no drink, while to the right it reads drink. The pointer has 2 scales along its side. The left side registers the amount of urge or desire for a drink that the individual is feeling at any given moment, while the other side would record the amount of resistance to a drink that the individual feels. The aim in achieving sobriety would mean that the resistance must be kept stronger than the desire for that first drink. Any time the urge gets to the power of 10 and the resistance is only at power of 5, the pointer changes direction and drinking can begin. The Big I concept also plays as a hurdle that it is to the recovery program. The alcoholic, for just the longest time, has the false notion that he knows better than anyone else what he ought to do to achieve sobriety. Don't tell me that I need all those meetings. Overconfident in his own ability to manage life, he stubbornly refuses to humble himself and to be open to following direction. The reduction of the Big I in favor of the virtue of humility is absolutely essential. My line of recovery from the triggering event is the top line in my diagram. 18 to 36 months is there as a goal in the sober life, but it comes to the person one day at a time. It is in that 24-hour period that the battle is won or lost for the moment. There are a number of pressures in this person's life that he is going to encounter and may indeed be defeated for sobriety to continue. I caption these as pressures working against sobriety. The personal bodily pain and discomfort would have him thinking about a drug that will take care of that condition. A few drinks and all pain is forgotten. Social life, being lonely, can be a problem. Maybe trying to be around the drinking friends again, too early and too often. Just because I've stopped drinking, he's saying, there's no reason why I can't still stop in the bar after work and just have a Mountain Dew. But what do you do when you enter that bar and the bartender has already your usual bottle of beer for you? Of course, you don't want to embarrass him, and so the relapse has happened. The usual places and people may have to be avoided. I may joke at times about the natural curve of the hand of the problem drinker, so that if there is not a bottle or a glass in that hand, he's aware that something is missing. The person may end up constantly drinking too much Mountain Dew just because of the hand situation. Even when a person is sober, there can still be problems with the car to deal with. There can be unexpected bills to face, difficulties with children to settle, just all manner of problems to be confronted and to produce all kinds of anxiety and fears. Anxieties and fears that have habitually been dealt with by taking a few drinks. A final pressure I call addiction is in the diagram. By this I am referring again to what I call in these talks flare-ups that we describe as possible for the recovering alcoholic. Everything in life can be going well for this person, but then in that kind of special 5 to 7 weeks or 5 to 7 months or even 11 to 13 month period, he has to deal with a great desire for a drink, maybe even dreaming about drinking. Additional support and help may be needed at these times. When I am giving this as a public lecture, it is at this point that I take something like a pool cue stick and I give a demonstration. Placing the cue stick on a table, I begin to push over the edge in one direction. Pushing it a short distance, no problem. But getting the cue over halfway off the table and it will begin to fall. Now if I push the cue on the table with my right hand and support the exposed part of the cue with my left, I am able to expose the entire cue without it falling. By this simple action, I am making the case for the possible wise need of supports to achieve the goal of sobriety. So what we see before us is what I call these props essential to stay dry. In using a first prop called faith or hope, I build on the notion that for the individual to begin the recovery process, there needs to be some glimmer of confidence that the effort put forth will result in something good for him. It may come out of desperation due to the shock experience that is now forcing this move to consider recovery. But some small degree of confident expectation will likely be present. The doctor, as a very early prop, suggest not only there may be need for some medical help required in the withdrawal from the drinking, but that in the years of drinking, heavy drinking, poor diet may also have resulted in serious physical problems which need to be treated and cared for. Doctors have, of course, been carefully avoided over the years because they are forever asking about your alcohol use. In recovery, the person may need to be ready to pay a few doctors to a doctor, which in the past he was always considered a big waste of money. Since about 1935, Alcoholics Anonymous has grown to be a nearby possible source of help for the sick person. This program builds on the concept that a former drunk maintains his sobriety by putting himself out, by sharing his story of drinking, and by his suffering with one still caught in the progressive disorder. My earliest and possibly some of my most meaningful experience in the field of addiction was in attending open AA meetings in New Hampshire in the 1950s. This 12-step approach to a new and different life has been God's gift to many a suffering person. To seek the help of AA is a wise move, and the price is right. It is free. The meeting is the medicine. Working the 12 steps is the therapy. I would venture a guess that the majority of addiction treatment centers in the US of A are all promoting AA as a valuable support in the community for aftercare. And the programs of Al-Anon and Al-Teens, there is also education and help available for the family members of the alcoholic. There are today many places providing treatment for the disease of alcoholism. Local communities, counties, state programs are offering the 30-day or even longer periods of treatment. Private hospitals have also developed programs and are offering the help. There are the large international known treatment facilities located across our nation, such as Hazelton Foundation in Center City, Minnesota. Most of the treatment programs today will include some period of time for sessions with the person's family. With insurance coverage for this disease, the competition for patients is always operational. The success rate of AA and the treatment centers of getting an individual sober and then maintaining sobriety is not too great. Relapses are common. Maybe the big I concept contributes largely to this. This is the area where the struggle between the urge to drink and the resistance to drink comes into play. Stinking thinking leads to drinking thinking, which leads to drinking and relapse. 6 months sober with AA attendance, followed by 4 months sober on his own, followed by a return to using. That cycle can be repeated a few times or even many times before he is eventually admitted to some form of inpatient treatment. 30 days or more later, he is returned to society sober in body, but the thinking and feeling part of him may not yet be convinced, which means more relapse. Can you begin to see why doctors and other professionals who have been working with this man begin to say, he is hopeless? The family had this notion for a long period of time prior. The power of the addiction becomes visible in the person's life. Now, there may be several of these inpatient treatments and still a return to drinking. For some of the more dissocialized person, there may be need for a structured environment like a halfway house following treatment. This is a living situation in which a number of men or women with drinking problems would share a supervised quarter for a much longer period of time. There have even been 3-quarter-way houses for those who require it as a bridge back to a free life in society. For those recovering people who still share responsibility for maintaining families, the need for a job is a must. The alcoholic person usually has some skill or trade to offer an employer, but their work resume would not win any prize. Disappointment in this area can sometimes be used as the excuse to return to the bottle or unfortunately move to other chemicals. It is possible that a doctor may prescribe a drug for the alcoholic called anabuse. This is a substance which, once built up in the drinker's system, will produce powerful negative effects should any alcohol be ingested. Instead of the desired effect from the drinks, one would now experience a flushing face, rapid heartbeat, growing feelings of nausea. For the person who chose to take anabuse, it can be a help in not reaching for that first drink. I have talked in the past to a person who took this drug and would still drink. He was willing to work through the negative effects to be able to continue to drink. There one encounters the power of addiction. Another person that I know said he took a vitamin pill each day for his sake and an anabuse pill for his wife's sake. Here is a man who feels confident in his recovery program, but yet is humble enough to understand the daily fears that his wife still lives with in regard to his sobriety. I have a prop that I labeled church. Some late-stage alcoholics, even Skid Row types, have gotten sobered and stayed sober through the ministry of, say, the Salvation Army or a gospel mission. These programs, which offer a soup supper and a dry clean bed for the night after a salvation-type religious service, have gained some converts. More are just using the facility as they descend to their bottom. But there is the church in a way that would be helpful to every believer. Most alcoholics have had a Christian faith background in the US of A. In the social disorganization which has taken place in the progression of the illness, the religious practices will eventually be eliminated. The grace of the sacraments of the Catholic Church will prove to be a great help in living the sober life for this person. We can still live out the grace we have received in the sacraments of our baptism, confirmation, and maturity and matrimony apart from the Mass. But for the nourishing grace of the Eucharist and for the healing sacrament of confession and the anointing of the sick, it is necessary to actively reconnect with Holy Mother Church. Sooner is better than later for this reconnection. But we have to realize that good people can sometimes be thoughtless in an attempt to be funny. Bar the door, Father. Look who's coming. The sensitivity of the recovering person may not find that humorous and react in an angry manner. This individual may need to have gained some feelings of self-respect and control to be able to handle snide and sarcastic remarks that people can and do express. Finally, I list hobbies or new interests as a possible support. This means that the person needs to consider wrapping his mind around some new interest. I do need to give a word of caution here. Just as the individual has overdone the drinking, so he can overdo the new activity. For example, the man decides to try to stay sober by getting into photography. So he must buy 4 cameras, build a dark room for developing, and spend all his time in this activity. Then he stops being interested in taking pictures. Now his newfound interest is bowling. So he buys a red ball, a green ball, a black ball, and is bowling 4 nights a week. He reminds his family that Bob Cross said he must have new hobbies and interests, but I didn't intend that he should bankrupt the family. Temperance in all things. These props and supports are needed for recovery to take place. Question: how long should support be needed? I would suggest that as a rule of thumb, only when the person truly accepts the fact that he is alcoholic and is willing to go to AA meetings, to follow the doctor's advice, take the anti-abuse daily, and do this activity for the rest of his life, is it really safe for this activity to cease. Later than sooner is a good rule to follow.